Hey everyone, it's Danielle. I had my third shift of my Scribe position at Mount Sinai South Nassau Community Hospital today, and I wanted to share with you guys today about what rounding is in a hospital, and really specifically in critical care units, because that's a big part of my position as a scribe, is to attend rounds and take notes on what's said at rounds. So rounds are basically kind of daily huddles, meetings that the care team has every day, where we discuss the status and plans for each patient on our panel or in our, part of the hospital basically. So usually who's involved is an attending of that specialty. So for critical care, it's a critical care attending. There may be residents, depending on the hospital. Also, here at this hospital, there are scribes, so I would be there as a scribe. There are also other advanced care practitioners, such as physician assistants and nurse practitioners. And then, of course, the nurses who take care of the patients. And in critical care, nurses are a huge part of patient care. They usually have... It's usually about 2 patients or 1 patient to every nurse. During this pandemic, each nurse in critical care has had about 4 patients. So they've been doing double their workload, and they've been doing it so amazingly. They have been so attentive to their patients, and just every patient should be so thankful for their nurse. Anyway. But I digress. So, usually what everyone discusses at rounds is there would be a brief sort of overview of the patient, what's their story, what brought them in, why are they in critical care. The nurse will then discuss any overnight events or any concerns the nurse has for the patient. Then the team will review the labs, imaging, other pertinent results for the patient that may have been, pending or that we got for the morning. And we usually do this through a systematic approach, meaning by system of the body. So first we'll do cardiovascular. So we'll look at the heart, be like, okay, was there any labs important for the heart? Any imaging important for the heart? And then what medications are we using for the heart? And then any concerns, anything we want to change. And then we basically do that going through cardio, pulmonary, renal, all that. So, and then we may try to do a broader picture of where we see the patient's course going. Meaning, if they start to recover, this is how we see, changing our plan for that. Or if they start to decline, this is how we see changing our plan for that. And other things of that nature. I can give an example today. There was a patient who has been on the floor with COVID, but also many other comorbidities, is very ill. Basically has not been doing so well, and the nurse communicated that to us this morning. We reviewed the patient's labs and images and by system, and we, throughout the week, we've adjusted the patient's, ventilator settings and medications, and nothing has really seemed to help. This patient has been in multi-organ failure, and in critical care, there isn't a specific treatment for multi-organ failure. We try to support the patient as much as we can. If we think for example, if we think the organ failure is from sepsis or infection of the blood, then we'll give antibiotics. But we can only support the body, and the body really needs to actively heal. Unfortunately, sometimes there's nothing we could do. And this patient was a case of that, where the PA or physician assistant working with us had to call the family and explain that unfortunately their loved one likely was not going to make it, that despite our best efforts, it was the patient's time. The big reason for sharing that isn't just to tell them, but because a big thing in care is code status, meaning if something critical happens, if the patient's heart stops, does the patient or the patient's family want healthcare providers to do chest compressions and intubate? As this patient was already intubated, it would just be chest compressions. But because of this patient's clinical condition, it's likely the chest compressions wouldn't really help. And that was explained to the family. So then the family agreed to a DNR, or a do not resuscitate order. And basically the goal of care for this patient, we still supported the patient, but also supporting the patient in comfort became a big goal as well. So, a more serious note, but it's a very important aspect of care. And rounding every day makes a logical sense of how patients come to where they are, and how you could get from the little minutia of their care to then also the broad scope of how we foresee this patient's course going, which is important. So then we can discuss things with patients and their loved ones.